are back, guys. As you saw, that was the Aramco event, and you saw it was from different ages. I mean, as Hannah already mentioned, I mean, there was a little kid, and there was also the youth spirit also in the event. There was a lot of people going in there at so many different ages. And coming back to the episode and talking about our real topic, guys, as we were mentioned in the beginning of the episode, it's going to be all about plastic surgeries, the advantages and the disadvantages. We're going to get into more details. Before that, we do want to welcome our guest, which also will do that.
Yeah, we do want to welcome our guest, Dr. Mohammed.alnasir, and he is actually a specialist in the field that we are going to be talking about, and it is all about plastic surgery. So welcome, Dr. Mohammed, on the show.
Pleasure, thank you.
Well, could you just please give us a little bit of information about yourself?
I'm a Saudi doctor, 35 years old, graduated in
King Saud University,
King Saud University, then I continued my postgrad in North America and Western Europe.
MashaAllah.
This is really great, and you're a plastic surgeon.
Yeah.
Plastic surgeon. So welcome on the show. We're going to be talking more about the topic, and
yeah, since we do want to ask you, Dr. Mohammed, what is the main reasons for people to come up to you as a plastic surgeon and ask you, I'd like you to change something in me? What is the main reason?
Actually, it's not quite that, because like probably you get this impression of the what you see in the media, like in the movies and television, like or probably you can see a very known series about nip tuck. I guess everybody knows, like someone who become plastic surgeon have this problem. That, but actually, plastic surgery is surgery. It's real surgery. So what you're hinting for is mainly like aesthetic surgery or cosmetic surgery.
What I'm asking about is that we, as the community, we do know that there are actually two kinds of surgery, or there are actually two main reasons for a person to go up to a doctor and tell him, okay, I have some kind of problem, if it's plastic surgery. If he actually doesn't like something about himself, let's say a nose, an ear, God knows what, or maybe if they got into some kind of accident and they actually do need some kind of repairing maybe.
Yeah, so it includes like reconstructive surgery.
Yes.
And aesthetic surgery. And other subspecialties, like you can touch on burn surgery, you have pediatric surgery, you have surgery related to tumors, skin tumors. So it's a very wide and vast specialty. But the thing, the field that shows up on the media is the field of the cosmetic surgery. So probably that's what the media is all about. So you don't see a lot in the media about burn patient or something, or accident patient that need reconstruction of their faces. Another subspecialty which is very important is hand surgery. Hand surgery by itself, it's a microsurgery and it's being done by a plastic surgeon. But nobody's really putting a lot of attention into this, because like they are concentrating on cosmetic surgery.
Yeah, because always we do have actors and actresses, and they always, at first they show up, I think, with the nose that looks like some certain way, and after some time everybody knows that she has done something to her nose, and then the cycle just goes on, and everybody will be saying she did something, and I want to do the exact same. That is what we always hear about.
Probably you're hinting to peer effect or peer pressure. This is not only in our society, it's in all societies.
Sir, I do want to ask you, what is the most common thing, let's say, I'm going to be talking specifically about women. What's the most thing they would come up to you and tell you, like, I need to do this? What is the most thing that they need to fix, let's say, in themselves?
Probably the face, because it includes many things.
Yeah.
What part of the face?
I'm guessing nose.
It's, nose is quite popular.
Females' lips, I believe.
Lips, augmentation, facial augmentation, cheeks, buttocks, fillers.
And this goes on.
Yeah, plasma rejuvenation is a new thing that I started in the kingdom 2 years ago. So it includes a lot of things, but mainly the face. You have liposuction, breast reconstruction, breast augmentation. So.
Well, doctor, we do know that it is all cosmetic surgery. I mean, if we do talk about cosmetic surgery, we do know that it is really complicated. But we always have this certain joke about it, you know, about when someone actually goes into that room, you'll need a hammer and some kind of big nail. So you just hit them in the face and that will be it. I mean, is it really possible, or is it really real that you have some kind of hammer and you keep hitting your patients? Because that is something we always talk about. Is it real or not? Just to clarify to everyone out there.
No, it's actually probably it's like a myth what you're saying. It's all about surgery in general, that you're having instruments in your hands. It has nothing.
You don't need a chainsaw.
It has nothing to do with the reality. Yeah.
Come on, you're scaring people out there.
Seriously, I mean,
But you get it from probably like media kind of effect. Like you see movies and you see that thing. But it's not
so
like
have you worked, sorry,
No.
have you worked like overseas? Have you worked?
yeah, I worked in Canada, in United States, France,
I do want to
Germany.
ask you, where did you find the, let's say, more patients coming up to you and telling you we need a plastic surgery? Here in the Arab world in general, or in Western world?
It's the Western world.
Western world.
Yeah.
I have a question for you too. Is that do you have that time when a patient comes to you and tells you, I want to fix that in me, and you say no, you don't need to, or like,
Yes, quite often.
and what kind of what is that thing that you refuse to fix in the face? Let's say
What things that I...
that
You
like
refuse
That usually refuse.
Yeah, I
to do.
refuse. If I think that the expectation of the patient is quite unreal.
oh,
Like the patient's asking for something that I believe it doesn't suit him or doesn't suit her.
So if someone actually comes and he looks like a wall and asks to be coming out like looking like Brad Pitt or Angelina Jolie for that.
It doesn't happen in our society, but if the expectation more or less like this, as you're, you will end up with unrealistic products or
there is a
results.
limit.
So you have to see what kind of expectation the patient's having in his mind in order to help him.
But if they're stubborn about it, let's say, like if a person comes up and tell you, like, I want to, let's say, fix my nose or my jaw or whatever that is, and they're stubborn about it, even if you go like, you really don't need it. I mean, like your face, I'm not going to be saying perfect, but it's, you know, it's beautiful the way it is.
I may refer him to another physician or other doctor, other
So
surgeon.
you refuse to do it. You refuse to do it. Well, I do want to talk about plastic surgery in general. I mean, as you mentioned, media effect has a big effect on everyone, I mean, in the world we're living in, as what comes to actresses, actors, singers, and everyone. I mean, even with you guys, because you guys usually, as men, I mean, they do not come usually for plastic surgery, but
No,
they
it's
would
usually
have...
about the hair. You know, I'm missing hair and I need some kind of implants or something like that.
Well, yeah, but I'm talking about usually women would come up to you and say, like, we need plastic surgery. When it comes to men, usually, but you do have a part where media affects you, and when it comes with the big muscles, and you guys take steroids for that. So you see, it's a part of the world.
That's not stepping into the field of plastics or cosmetic surgery.
It's
I
not.
don't think so.
But I'm saying how media affects us and affects everyone. Do not think it's only women or men. I mean, it's everyone. But when it comes to women, a lot of people are not really satisfied with how they look just because of what we see on the media. And guys, just to make it clear or to pop your bubble, I mean, the people you see on TV or whatever award you're watching, or no matter what it is, they're really not themselves. I mean, it's either they had something done, or it's the camera, or they photo shooted, or they fixed it, or photoshopped.
Yeah.
Exactly. So they're not really real. I mean, if you find you're not really satisfied about something and you really think it needs change, you can, go to a consultant, talk to a doctor, and like give and take, like understand if he tells you you do not need it, then you really don't. But if there's something, let's say, that really, is not let's say
something
beautifying
that's not
your
normal,
face,
maybe.
yeah. And usually, I mean, even in Islam it's mentioned, like usually if you have, let's say,
no reason to,
exactly,
so that's haram.
Exactly, and it's haram to change the way you're looking just because of an actress you saw, and especially because I've seen that a lot. I mean, even we had doctors, before they would come and they go like, well, I have a lot of patients that they say, I want to look like Angelina Jolie, or I want to have her lips, or I want to have I don't know what. So they would always have these pictures. I want to go like, I want to have her nose and her lips and her cheeks. And
So
I mean, exactly, and they really mess themselves up.
That's true.
End up looking like Salah.
And let's not forget, like like by time, like everything will like get messed up in her face. Is that true? Or like by time that plastic surgery will like be ruined by the skin, or I don't know.
Yeah, if she is being subjected to many surgeries, probably she won't have like a lot of tissues that she can can support her face, so she will end up with problems, complications.
I want you to talk to me about the mishaps that go on in the surgery room. I mean, things you have heard, even, I'm not saying that you have done, I mean, things you have heard that sometimes you put an example to your patients, like it's kind of dangerous because it's not really, 100% chance that it's safe, even though it's a cosmetic surgery, but it's still a surgery, as you mentioned.
Probably I would say two things. Fillers, probably now it's very common. We can do it not in the operating room, we can do it in clinics. Yeah. And there are specific fillers that's approved by the health authorities in the United States, Saudi Arabia, Europe. And it costs a certain amount of money. But some people, they would seek other products which look cheaper compared with these products. And they would think that's the same, but actually it's not the same. Because they will end up with complications in terms of abscesses and stuff like that. This is one thing. The other thing is about the plastic surgery tourism. Like people would say that I would go to this country or that country. It would be like a package. So the package include like hotel stay and entertainment and among other things, plastic surgery. So you don't have any guarantee on the result. Surgery, you have to look at it, it's really medicine. And it's an act of medicine. So there will be some commitment to the patient. So you cannot just go and have like your nose fixed. Probably you end up with a major complication. And you won't have this chance to go back to this country again.
How bad can it get, the complications? How bad can they be?
It's not very bad, but I mean, if the physician knows what to do and the surgeon knows exactly what to do, usually the patient will be in safe hands. But troubles comes from, like, if you, as I told you, you are going there and you are not seeking a well-trained physician and stuff like that.
I want to ask you a question, and that is that when you look at someone, you know if that person did a plastic surgery or not?
Sure.
Okay, then I'm going to ask you that question. Okay, I wanted to know that like long time ago, so just...
Go ahead.
Okay, about Michael Jackson's nose. No, really. Every time I look at
Was it real?
his face, no, I'm sure it's not real because like you can see the differences back
Between
then.
when he was black and then became magically white.
Yeah. Is it from candle, as they say, or something like that? I don't know.
So what do you see?
I don't know, but it's not real. That what I see.
Yeah, but tell me, what do you see?
No, she says that she thinks that it's made of wax.
Wax or something, yeah.
Is it possible medically? I mean,
I don't know.
To have a wax
Is
nose?
it plastic or something? I don't know.
No, it's patient. I mean, if the patient's being subjected to many operations, so the tissues will not be the same as before.
Yeah.
So it will be more fragile. So, but it's not like you will put some kind of material or something. But redo surgeries are more difficult because the tissues are not the same as the original tissues, because it's being subjected to scarring, fibrosis, stuff like that.
Okay.
Oh, yeah. That just
answered your question.
Yeah, no. When you said that it's made of wax, it gave me this idea. That's why he doesn't really walk in the sun so much. Yeah, because if he walks in the sun, he'd be melting and everything. That's just a stupid idea.
May he rest in peace.
May he rest in peace.
Anyways, going back to the topic we were already talking about before Michael Jackson's nose, plastic surgery in general. Sir, do you see nowadays that everyone looks alike?
No.
No?
No, usually on the TV. Basically she means
TV.
On
Not
TV.
here, because I mean, you already mentioned the Arab world. We don't have that much of...
It's the problem with the Arabic words, because it's under the majority of the Arabic words, under the influence of the Anglo-Saxon kind of culture, which is the English, British, Australian. So they are not more open to other Latin cultures. So if you would see the American kind of thinking, they have this belief that bigger is better.
Oh.
You can see it in the US, big cars, big houses. It's not really true. So people try to imitate that. So if they have bigger cheeks, bigger, you know, other body parts, they would think that it looks nicer, but it would look ugly.
Which is
So
not right.
you know, so
Well, honestly, a lot of people be thinking normal is the way to go, be it anything in the body. But for now, we'll stop a little bit with the discussion, and we'll go with the report, and then we will be back. Hello and welcome back, everybody. That was the report. Thank you, Nihat, for being there, and we value everyone's opinion on the report. And Umar too, yes. And you know, as we saw from the report, everyone was actually almost always talking about plastic surgery and how they should not do it unless if they need to. You know, so basically everyone was talking about cosmetic surgery. So you think that is also the effect of the media, and how can we change it?
you cannot. You can see probably the media is so powerful nowadays, and it can change a lot of things in the world. So you really cannot counteract the power of the media. But you would, I won't say that you go with the flow, but you have to know what's right and what's not right.
Exactly.
So the thing that you need to be done, you can seek medical help, and the thing that not unreal, so you have to abstain from.
Yeah, so
Exactly. And
basically
another-
just ask a specialist and asking for his opinion and thinking for ourselves. That's
And
basically
another thing, guys, just make it in your head, and always, if you are always hesitant to go to a plastic surgeon or fix something just because you've seen some actress on TV, or just because your friend commented about something in your face, let's say, for several times, and it just hit you, maybe I would need one. Just think, if you have done something, I mean, and you did it and it's done, something else will be uneven. So they would have to fix that, and then, you know, something else will be uneven. And it's an ongoing
And it goes
cycle.
on, yeah.
And trust me, it goes on. I mean, even let's say with the nose, sometimes you would have one, it still looks not that good. You would have to do it again and again and again till it's, you know, and it's perfect. The way you see, like, all actresses, everyone have the same nose, same lips, same eyes.
Yeah, it's like they
And-
all came out from the same workshop.
Exactly. And I mean, Allah created us with, you know, different features. So if we're going to be all looking the same, there is no point. I mean, it's really pointless.
It's
And
not even
everyone-
about that. You mentioned that point that, oh, when your friends comes to you and say, like, your nose is not good, or your cheeks, you look something, I don't know, or what is it, but you must believe enough in yourself that you look good, you look pretty, because God created you that way. Unless something happened to you, like a car accident or
La samah Allah,
anything, la samah, then at that time, I think you should think like more than one, think more than twice to go and do something with anything that change
face,
something
yeah.
in your face.
Yeah, you know, and it is cool maybe to have some kind of scar maybe or something like that. There's,
To guys,
you-
yes,
yeah.
but I don't think to, like...
yeah,
you
imagine
know?
if you had some kind of scar that's going like this, and you'd be like, okay, no, I'm the Braveheart of, I don't know, my neighborhood or something like that. Maybe, maybe that'd be cool and everything, but you have to seek medical attention, because you do know, you get into some kind of accident, la samah Allah, of course you need to ask people what can I actually do to remove the scar, or I don't know, something that you're not satisfied with. And don't always let your friends get to you. Usually they'd be just making fun of you just because you're you. They want to have fun, that's it. If you have a big nose, they'd be coming to you and talking about your nose, that you can knock down a wall with your nose or something like that. But that is not the point. You have to have enough confidence in yourself to actually say, yeah, so what?
Yeah.
Not to that point, guys. Not to have confidence in so what. As I mean, Hannah mentioned, like, if you have an accident, la samah Allah, you think you really need it, and even if you're not really sure, guys, in any kind of occasion, just go to a consultant and talk, give and take. If you really need it, then you do. But there are some surgeons that usually, let's say, they seek perfection. So when they see a face, they would be like, you know, this is not right, and this is too puffed, and this is too small, and this is, you know, I'm sure you're not that kind of surgeon, right? Okay, good. So when people come to you and they say, like, I already went to a doctor, and they said, I need this and this and this, and you don't think they really need it that much, what do you tell them?
Probably you're hinting to beauty in general.
Yeah.
So when I started saying like realistic expectation, like every lady that has a photo or has an image in her head how a pretty lady should be. Okay, so beauty doesn't exist. You know, It's really.
See, and this is coming from plastic surgery.
Beauty doesn't exist.
Yeah.
If you like something, you will see it pretty.
Yes.
You will see it beautiful. If you don't like it, even if it's very beautiful to another
Depends on
person,
who's looking at it.
it won't be pretty. You know? So you have to like this thing in order to find it pretty. If you don't like it, you won't find it pretty. There is a well-known say, it's beauty in the eyes of the beholder, and that's very true. You know.
True.
So some physicians, they would look into this from their own experience, their culture. So a surgeon in Europe, Western Europe, is different from a surgeon in Eastern Europe, and it's different from one in North America, different from one in Brazil, different from one in the Middle East. So everyone has his own culture, his own history, his own perception of beauty.
Yeah,
so all these play a factor. So probably if you go to a physician or a surgeon, number one, he would tell you stuff, and the other one would tell you other things. You know?
Exactly.
Yeah,
we want to
that is really true, and really words of wisdom. Because a lot of the time, people will be coming and saying, okay, that's not beautiful. You'd see, looking at another person, would be saying, okay, it is actually really beautiful. Every person has his own perception, his own point of view on what's beautiful and what's not. And right now we do have the website of the doctor, and it will be showing on the screen his website and also his Facebook page. You can log on Facebook and look it up, and also the site. You can just go on and ask the doctor for any questions you do want about plastic surgery, about cosmetic surgery, about any kind of field in the surgery you want to ask. Please do go ahead and ask, because knowledge is power. And
since you were saying about asking, and I'm going to ask him a question. I have that question that always pops in my mind, is that whenever like something happened to a person, like a car accident, or that person slipped and something happened to that person's face, is it better to do the plastic surgery with the surgery that that person needs, or to do like
two different occasions?
Yeah, or to do one and the plastic surgery then?
To do one? What do you mean by that?
No, for example, if someone fell and broke a leg, subhanallah, and you need, of course, to go to the doctor who will actually fix your bones in proper way, and then you'd have the doctor who actually make them look good again. So
this is
on
what
the same occasion?
Yeah, it's something like that. Like if I, let's say, slipped on the floor and something happened to my eyebrow or something, like it got open or something. So do you rather just let the first
primary care physician
to like close it, then do the after like few years do the plastic surgery, or both of them at the same time?
If you have an access to a plastic surgeon, it would be better to get an easy access. It would be fast and more efficient. Yeah, if you haven't, usually don't have that access, you know. But usually you'll be seen by ER doctor or primary care doctor, and he will do most of the time a good job. And later on you can see your plastic. So
not what needs fixing.
But if you can have like one from the start, that would be great.
Oh, so yeah, you say that to do it like whenever it happens is better than to keep it for like a few years later.
Yeah. So doctor, there is actually this question that has bugged me for some time. A lot of people will be saying, okay, my face, let's say my right side doesn't look like my left side. So is it really normal for a person to be 100% matching on both sides, or is it the normal thing that your face has different features on the right and the left?
The normal thing that you don't have symmetrical face. Each half is not the same as the other one, so it will be like almost like 95% or 90%.
Really?
Yeah, everybody's like this, and the degree of asymmetry is different from one person to the other. You know.
So it's not. There is never 100% symmetry. No one, nobody. Even after surgery,
even
can
after
it be
surgery.
done? Even after surgery, it can't be done. Okay, so.
But people
I think
still
we can
try
notice
to do
that,
that
from, I guess we notice that from our hands. Like you have, whenever you wear a ring, females most notice that whenever your right finger is like the size of it or smaller.
Yeah.
I think it's a normal thing. You got what I mean?
Yeah, I do actually, but it's kind of weird when you ask somebody like that it is actually your face is not really symmetrical, so it can't be done 100% even after surgery, but they still go ahead and do it.
They still go ahead and try. their best too, guys. I mean, my best advice is to love yourself fully. And as you mentioned, I mean, beauty differs from one person to another. And I mean, beautiful, let's say, to me, could be, you know, just with, let's say, no makeup on and you just being the way you are. It's, you know, she could be gorgeous. And for you, for let's say, makeup and plastic surgeries on and, you know, having everything, let's say, fake. Because the way I see it, the things that they have been doing is fake and that's not really them. So guys, if you do love yourselves and you show people that you love every part of your body, even the things that you're not really sure of, if you really love it, people will see it too and they would like it. They won't be talking about, oh, her nose and her lips and I don't know what. So if you guys just love yourself fully, I'm sure you're going to be sending that image to the other people. Anyways, as we are losing a lot of time.
No, actually, I do have one more question for the doctor before we do end up, because we are losing a lot of time. We do know that some people would go and try to get rid of fat in some kind of surgery by suction or whatever. So there would be, even after the suction, there would be still the excessive skin on there. So would you also remove the skin after, or it just stays like that?
It's a good point. Probably you have to judge whether it's really excess skin or not very much. Okay, if small amount of lashed skin, probably you can do some kind of laser liposuction. This is one of the new advances in liposuction. You can see it also on the website. I did like some video. It's more of like a tutorial. You can go log on and it will get a lot of information about that. So laser will act on contracting the components of the skin. So you'll get some kind of retraction. So you don't have to excise the excess skin. But if you have so much, the amount of excess skin is so huge to the degree that it would affect the look after the surgery, so you would opt to some kind of resection. So you have to remove this part of the skin and do some kind of contouring surgeries. You have laser, we do have other things like you can get laser, it's like ultrasound, assisted lipoaspiration or liposelection. It all helps, but you have to go to your surgeon and he would examine you first and he will tell you what thing is best for you. You cannot just go to any like center and you need this. You know.
Exactly.
Well, thank you very much for your time, Dr. Mohammed. It was really educational and full of information and also wisdom. Thank you very much for your time.
You're
and
welcome.
it is really our pleasure to have you on the show.
Me too.
Well,